Well, Canada is also seeing an increase of cases of norovirus, a highly contagious stomach bug. The norovirus activity has been on the rise, largely due to the lifting of COVID-19 pandemic measures. The virus typically causes vomiting, nausea, as well as diarrhea, and it is spread through infected bodily fluids. Symptoms will tend to fade after about 24 to 36 hours, and experts are advising people to frequently wash their hands as well as disinfect surfaces before touching them. Let's bring in Dr. Alan Grill. Dr. Grill is Chief of Family Medicine at Markham Stouffville Hospital. Great to have you, Doctor.
Good afternoon.
I want to pick up from the conversation I think you were having over the weekend with my colleague there with regards to this outbreak, I guess, that we're seeing. What are your concerns right now? Or are we just, was this expected considering pandemic restrictions were being leveled off and now we have, well, essentially more exposure?
Yeah, I'm not overly concerned in the sense that norovirus is a virus that's been out there for a very long time. In family medicine, we see a lot of this typically from November through April. And as you said before, people don't feel very well. They get a lot of sort of stomach pains, nausea, vomiting, and it can be very contagious. So this spreads very quickly, especially within households. Again, the reason why I'm not overly concerned is that we know what it is. We know sort of how to prevent it. The key is to know also what signs to look out for and when to seek medical attention. And I think the reason why we're starting to see more cases right about now is because with the pandemic and the public health restrictions lessening over the last few months, there's more people congregating, more kids are around other kids. They tend to put their hands in their mouth more often than adults. And so when people congregate more and they hang out more and you have less of these restrictions around, that's how you get spread of this virus. But we see this every year. It's very common. And I think it's important for people to know sort of how to prevent it and then what to do if they actually get infected.
Exactly. Disinfecting those surfaces, washing hands. If someone does have it, of course, protecting yourself and, maybe even considering wearing a mask around the house just to prevent spread. But some who are more vulnerable, we know we've talked about kids, the concern there to keep their liquids up if they do get this, but also seniors as well, those in long-term care homes. Talk to me about, there is a concern there with regards to their health if they do get it.
Oh, yes, absolutely. So, this isn't, I don't want to downplay how sick people can get. Younger children, particularly those under age 1, older seniors, the more frail seniors that tend to live in long-term care facilities, and those that have compromised immune systems. I mean, this can be a very nasty virus to get. And the problem is you get dehydrated. So because you're having, diarrhea and vomiting, you have to replace those fluids by drinking a lot. And we tend to tell people to drink as many fluids as they can tolerate. Oral rehydration fluids, things like Pedialyte for kids, they also come in popsicles, which are easy to tolerate. You have to make sure that they're drinking enough. And some of the signs to look out for in those populations, so the older seniors, if they're really lethargic, like they're super tired, hard to wake them up, they're feeling really lightheaded, they may be dehydrated. Or with young kids, if they're crying and tears aren't coming out, if their mouth looks really dry, if their feeding is down, especially if their number of wet diapers for really young kids is down from the typical sort of 5 to 6 per day, you have to get on top of that and seek medical attention if you're worried that they're dehydrated. There are some people that get hospitalized for norovirus. They tend to need intravenous fluid. So it's not a benign thing. But as you said before, if we wash our hands really well, particularly before preparing food, after we use the washroom, if we're caring for someone, wiping down surfaces, staying home if you're sick, sort of isolating yourself, that's how you decrease the spread and prevent getting it at the same time.
What's the incubation period for something like this?
So typically, if you get infected, you can present with symptoms sort of within 1 or 2 days. It happens pretty quickly.
Okay.
And then once you get the symptoms, usually they last between 24 and 72 hours. So it's short-lived, but within that short period of time, as mentioned before, you've got to keep your fluids up and you have to make sure that it's not spreading to everyone. So all of a sudden, everybody in the house gets it. So again, lots of fluids, washing your hands, cleaning those surfaces, staying away from others while you're sick. And then usually we tell people that when they're feeling better, they have to have no symptoms, none of this sort of vomiting, diarrhea, fever, for at least 48 hours before we think that they're in the clear. But again, we still think that the hand hygiene is key because sometimes you can still shed virus even after you're feeling better.
That's really important to note because we want to make sure, again, we're keeping the case levels down and keeping everyone at home safe. Dr. Grill, great to have you on this. Appreciate it. See, you're working there, so hopefully it's not a crazy day for you. Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital. Thank you again.